1, 2, 3.
Okay, thank you for attending, everybody. Today, I'm going to be giving an informative speech on cystic fibrosis. Lung function is critical to the preservation of life. How do you think it would feel to have lungs that were constantly under siege by bacterial infection and thick mucus to the point that you could barely breathe? This is only a small part of having cystic fibrosis. Cystic fibrosis is a hereditary and potentially life-threatening disease of the lungs, endocrine systems, and gastrointestinal systems. Currently, there is no cure for CF, which is cystic fibrosis. Cystic fibrosis remains a debilitating disease that needs to be cured, and research and development funded by the Cystic Fibrosis Foundation have been key in improving the quality of life of patients afflicted with this disease. Today, I will share some facts and characteristics of CF with you, and will tell you how the Cystic Fibrosis Foundation is trying to fight it. Over the last 25 years, knowledge about the cause and effect of cystic fibrosis has progressed significantly due to research and development funded by the Cystic Fibrosis Foundation. It is now known that cystic fibrosis is caused by a genetic mutation and affects about 30,000 people in the United States and 70,000 people worldwide. And this is according to the Cystic Fibrosis Foundation's website. The gene responsible for this disease was identified in 1989 by researchers affiliated with the CF Foundation. This gene has been named the Cystic Fibrosis Transmembrane Conductance Regulator gene, or CFTR. The disease is only contracted when 2 recessive genes, one from each parent, are inherited by a child. It is possible to be a carrier for cystic fibrosis without being affected by the disease itself. As I mentioned before, CF is currently incurable, and current treatment focuses on managing symptoms. Most of them, anyway. To properly convey the goals of the Cystic Fibrosis Foundation, it is first important to establish what having cystic fibrosis means to an individual. Many people with cystic fibrosis suffer from chronic lung infections, inability to clear thick, sticky mucus, and gastrointestinal complications. Even with dramatic improvement over the last 30 years, according to the U.S. National Library of Medicine, the average lifespan of a CF patient is only 37 years. Lung infections are often treated with antibiotics, including the inhaled antibiotic tobramycin, with the brand name for that is Toby. It was specifically designed for CF patients because you can use a lower dose as opposed to an oral antibiotic, and it is the chemical tobramycin is exposed directly to the lung tissue where the infection is. So, thick mucus caused by poor regulation of chloride ions in the body is generally treated with mucolytic drugs, which are drugs that break up mucus. An example of one of these is called Mucomyst or acetylcysteine. It's also an inhaled medication. Thick secretions and the associated inflammation that it brings is often treated by catabolic steroid drugs like prednisone or other non-steroidal anti-inflammatory drugs like aspirin or Advil or Aleve. They also use bronchodilators to dilate the airways of cystic fibrosis patients. Albuterol is an example of one of these. It's common for many people to carry that in a meter dose inhaler, your little pump inhaler, or they can give an inhaled nebulizer treatment of that. So, if the lungs have sustained too much damage from constant infection and scar tissue, a lung transplant or a double lung transplant is an option, but it only buys time for the patient and does not cure the disease. Eventually, the thick, sticky secretions will come back, and those promote infection, and you're basically start at square one of the same problem. So, but in 2012, a new drug called Kalydeco was approved by the FDA, and it treats CF at the genetic level. It helps the body regulate chloride ions more efficiently, so the mucus that is produced is not, it's not as copious, it's not as thick, there's not that large an amount of it, and it's easier to clear out of the airways. And yeah, this medication, will definitely serve to extend the length and quality of patients' lives. The Cystic Fibrosis Foundation's mission is to cure cystic fibrosis. According to their website, it was established in 1955 and based in Bethesda, Maryland. In 1955, it was rare for a child with cystic fibrosis to live long enough to be able to attend elementary school. Scientists supported by the CF Foundation discovered the gene that caused CF in 1989, and may someday be able to correct the mutation using gene therapy. Although significant progress in the battle against CF has been made, there is still much work to be done. Cystic fibrosis continues to be a debilitating multi-organ system disease with a genetic cause, and the CF Foundation is committed to finding a cure for it. As an aspiring respiratory therapist, part of the patient population I will be responsible for treating will be patients diagnosed with CF. A number of therapies and treatments have been developed to effectively manage their symptoms, but one day, instead of telling a patient how to manage their symptoms, I'd like to tell them that there's a cure for their disease. And that's the end. So thank you.